Good afternoon. I'm Reem Ali, Vice President at the Health Policy Institute of Ohio. Thank you for joining this third Strategic Action Plan on Aging work team meeting focusing on community conditions and health behaviors. We are excited to be able to convene this work again in the midst of this pandemic and want to express our appreciation for all of you and the work you have done to combat COVID-19. We also want to thank you for taking time to contribute to the Strategic Action Plan on Aging. Before we get started, I do have just a few housekeeping items. For now, everyone is in listen-only mode. We want this to be an interactive meeting, so if you have a question, do type it into the question box. There will also be opportunities throughout this afternoon's webinar for discussion. During the discussion, raise your hand and we will unmute you. Keep in mind, if you've muted yourself, you'll need to unmute your audio. To participate, please make sure that you have entered your audio PIN. You need to log into the webinar first before calling in order to get your PIN. Both the slides and a recording of today's work team meeting will be posted on the SAPA Advisory Committee page. You can find this by going to hpio.net and clicking on groups. HPIO is facilitating development of the Strategic Action Plan on Aging, or the SAPA, under contract with the Ohio Department of Aging. We are joined this afternoon by Carmen Clutter with the Elder Connections Division at the Department of Aging. And you will also be hearing from my colleagues, Zach Reet, our Director of Data and Management Analysis at HPIO, and Health Policy Analysts Haley Aka and Carrie Almasy. As a reminder, HPIO is a nonprofit, nonpartisan organization whose mission is to provide the information and analysis needed to create evidence-informed health policy. We are convening this group to provide ODA and HPIO guidance throughout the process of developing the SAPA, as you see here. Now, before I update you all on the process and timeline for this work and hand it off to Carmen, we did have a little poll question for all of you. And I know that for some of you, this may not be your first work team meeting, so we want to express our appreciation for you joining a second or maybe even third work team meeting. But particularly for those for which this is their first work team meeting, we know it's been a while since we've seen you. And wanted to know, how much do you remember about the SAPA process and the SAPA itself? Do you remember everything? Do you need a little refresher? Do you not remember much? Or are you really unaware or unsure of what the SAPA is and you need a big refresher? I want to make sure that our poll question was thrown up there. It looks like it was there and then it maybe disappeared. Are we able to relaunch that poll question, Alana?
Yes, but it's going to take a second. It disappeared for a reason and I'm fixing that right now. 1 second.
All right. We've had relatively smooth webinars. Of course, there are always some technological difficulties. So we appreciate you bearing with us. Galen's entertaining us with this poll question.
So, Reem, this is Zach. I just wanted to share, we've learned on previous work team meetings that some people have trouble voting. If you're having trouble, you can try minimizing your screen and then voting. That was the feedback from previous participants.
Thanks, Zach. Looks like folks are voting now. We want to make sure we have full participation. So we'll be watching the participation numbers. This is the only question on other work team meetings that we've gotten full consensus on. So if that gives you any sort of sense of how this is going to go, the rest of this conversation is going to go. All right, it looks like we have, most folks have voted. Let's go ahead and share those results. All right, so we have a little more than half remember everything. About a third need a refresher, and some don't remember very much. Well, we will make sure to go over all of the SAPA information with all of you again. and appreciate you entertaining this poll. It looks like we might have some newer folks, folks that might not have been on previous work teams, so we'll certainly walk you through that process. All right, and with that, we're going to transition to our agenda for our meeting today. Might take a second to get that back up. Okay, everybody should be seeing today's agenda. And then here are our objectives for today's meeting. By the end of today's webinar, we will have guidance needed from all of you for the prioritization of desired outcomes and indicators for the community conditions and health behavior topic areas of the SAPA. And with that, I will hand it over to Carmen to provide more context on this work.
Thank you, Reem. I first want to start off by welcoming all participants to our very third SAPA work team meeting today. If you're part of the very first two work teams, welcome back. And if you're new to our work team meetings today, we're very happy to have you with us. Thank you for contributing your expertise and your time today, especially during the current pandemic. And on behalf of the Ohio Department of Aging, we are so appreciative for the opportunity to work with Health Policy Institute of Ohio to facilitate the development of our Strategic Action Plan on Aging, known here as the SAPA. And we're very excited to have each one of you involved today. I do want to take a few moments to revisit the purpose of the SAPA. When addressing community conditions or social drivers of health, it's important that the unique needs of older adults are considered. Efforts to address health inequities across the state need to be both intentional and inclusive of our older adult population. As a network, we have an opportunity to address many of these social drivers of health, including community conditions and health behaviors. The SAPA will build on our current state plan on aging and also align with Ohio's 2020 to 2022 State Health Improvement Plan, otherwise known as the SHIP. The SAPA will highlight priority topics and outcomes to answer the question, what is most urgent to achieve well-being for older Ohioans? The SAPA will include prioritized and specific action plans that state and local partners can use to ensure that all older Ohioans achieve their full health potential. Achieving the SAPA vision that Ohio is the best place to age requires a very coordinated approach to implementing strategies within the SAPA and the SHIP. While today is our third convening of the SAPA work teams, a great deal of work has already been initiated and completed. During the second advisory council meeting, HPIO introduced the summary assessment and its key findings. I'm happy to share that the summary assessment of older Ohioans was published back on Friday, June 5th. And this assessment provides a comprehensive picture of health and well-being of older Ohioans, which will be used to help inform the development of the SAPA. The summary assessment addresses two main questions. The first question, what are the biggest health and well-being strengths and challenges for older Ohioans? And then the second question, what factors impacting the health and well-being of older Ohioans are most important to address? During the second advisory committee meeting, many of you were engaged in dialogue to prioritize subtopics for SAPA outcomes and factors. Following that meeting, many advisory committee members completed an online survey to then independently prioritize subtopics within each outcome and factor area. So thank you so much for your feedback and your response. And today the HPIO team will walk us through these survey results to help inform our activities for today. But before I hand this back to HPIO, I do want to take some time to just remind us all about the importance of prioritizing topics and the need to be concise in our approach and our strategy. The SAPA needs to include a narrow set of priorities with SMART objectives. So those are items that are specific, they're measurable, they're attainable, they're realistic, and they're timely. In addition, these objectives should also include establishing performance targets, identifying priority populations, and also selecting evidence-informed strategies. So within our prioritization, we need to be able to assess and report progress in a meaningful way that's able to be reported at the state and the local levels. We need to be able to identify the magnitude, the severity, and the inequities of the problems. We obviously want to ensure alignment with the state plan on aging as well as the SHIP. And then we also need to make certain that there's a potential for impact. So there is the availability of evidence-informed strategies across the subtopics at both the state and the local level. So again, thank you for joining us today. We're really pleased to have you here today. And without further ado, I will go ahead and pass it back over to Reem.
Thank you, Carmen. Hopefully everybody can hear me more clearly. If not, I know my HPIO team will let me know. We are very excited to continue work on this project and look forward to creating an actionable plan that improves the health and well-being of older Ohioans. I shared this slide with you just a little bit ago, but now that you have more context on this work, wanted to share it with you again, just so that you can see what the role of this advisory committee is throughout this process. In creating the SAPA Advisory Committee, we were very intentional in reaching out to a wide variety of partners and sectors. We have 61 individuals participating on the Advisory Committee, representing all of the sectors you see here. We were also happy to see strong participation in the work teams. You can see here the number of advisory committee members serving on each of the work teams. Community conditions and health behaviors and the social connectedness and preserving independence work teams got quite a bit of love. Later this afternoon, we'd like to get feedback on stakeholders we can reach out to for additional expertise regarding strategies and target setting for each of these work team areas. This is an updated SAPA timeline. As you know, we completed the summary assessment of older Ohioans, and as Carmen shared, that has been released. You can find a copy of the summary assessment in the Handouts tab on your GoToMeeting screen, and there are also links to it on the ODA webpage and a HPIO SAPA page. We will hold work team meetings and conduct key informant interviews throughout June and July. And during that time, we will also be working on recommendations to strengthen data collection and evaluation across the aging network. Given delays due to COVID, we now expect the SAPA to be complete at the end of September. HPIO will assist in dissemination of the SAPA and develop some technical assistance materials to inform SAPA implementation through the months of September and October. The summary assessment of older Ohioans provides a comprehensive picture of the health and well-being of older Ohioans, drawing upon multiple sources of data and information to inform development of the SAPA. Through the summary assessment, you may recall we identified 6 key findings reflecting the current state of health and well-being of older Ohioans. We discussed those key findings and data in the summary assessment at our last meeting in early March, and the feedback we received from all of you was used in development of a survey to prioritize topics to focus on in the SAPA. As Carmen described, the SAPA will be a prioritized and specific action plan that state and local partners can use to ensure that all older Ohioans achieve their full health potential. It will be a tool that can be used to advocate for the implementation of strategies and to advocate for funding for the implementation of strategies as well. The purpose of the SAPA is to build on the state plan on aging, align with the state health improvement plan, which was also recently released, to answer the question, what are the most urgent priorities to focus on to achieve health and well-being for older Ohioans? The process to identify those priorities is multi-component and is being informed by the State Plan on Aging, the State Health Improvement Plan, findings from the summary assessment of older Ohioans, key informant interviews, and your input as part of the SAPA Advisory Committee and the priority work teams. This advisory committee, along with members of the priority work teams and key informants, will be instrumental in prioritizing the topics to focus on in the SAPA, including setting SMART objectives, which are specific, measurable, achievable, realistic, and time-bound, informing performance targets, identifying priority populations, or those communities which are most at risk for poor outcomes, those communities of older Ohioans most at risk for poor outcomes, and identifying evidence-informed strategies that can lead to improvement on these set objectives. Our work today will get us one step closer to identifying each of these components. This is the conceptual framework that guides the SAPA work developed with your input to define the scope and focus of the SAPA. You'll note that there has been additional refinement since we last met, and in just a moment, Haley will share how this conceptual framework was further refined based on the online survey that all of you provided, as well as our previous work team meetings. Now, before we move on, I do want to give all of you an opportunity to ask questions if you have any. Please feel free to enter your question into the question box or raise your hand using the hand icon and we will unmute you. Keep in mind, if you've muted yourself, you will need to unmute your audio. And to participate, please make sure that you have entered your audio PIN. You will need to log into the webinar first before calling in order to get that PIN. I will just give you a few moments to put in any questions into the question box. I know that there were quite a good number of you that were wanting more context and information on the SAPA, a little reminder of our journey and how we got to where we are. So hopefully you feel comfortable in moving forward, but if not and you still have unanswered questions, please do let us know. I am not seeing any hands raised right now. And I don't see any questions. So I think I'll go ahead and hand it over to Haley to talk about the process for today.
Great, thanks, Reem. I'm gonna get the slides transitioned over to me so that we can keep on going. Perfect. All right. And thanks to all of you again for being on the call this afternoon. We really appreciate you taking the time and walking through this work with us today. So today, like Reem mentioned, we're going to focus on continuing to narrow down and prioritize those outcomes that will elevate in the SAPA. Again, these are the sources of information that we're drawing upon to set our SAPA priorities. And at this point in the process, we're really focused on that last piece of feedback, your input as our stakeholders in our work team and the rest of the advisory committee. And we're doing that through a couple of different avenues, right? So, our last in-person meeting way back in March, we discussed what topics would be prioritized in the SAPA. We then sent out the SAPA prioritization survey in May, which collected feedback from all of you, the entire advisory committee. And now, of course, we're walking through our work team meeting process where we can get into further detail about what should be prioritized in the SAPA. And we, again, are just really excited to hear from you all today. You guys are the experts here, and we really value your input and expertise, and just thank you for being a part of this. What we'll do first is share the results of the SAPA prioritization survey with you so you can see kind of what that's looking like at this point. We'll then head into our primary task for today, which is to discuss the best ways to narrow down the community conditions and health behavior subtopics into a set of measurable outcomes that could be tracked in the SAPA. Again, we used the feedback from small group discussions on March 2nd to craft that survey, which was sent out on May 13th. The survey went out to all members of the advisory committee, and a total of 36 people were able to respond to that survey. As a reminder, these are the criteria that you were asked to consider as you prioritized subtopics in the survey. These continue to be really important for our work today, so I'm going to go through them just really briefly. We want the outcomes that we elevate in the SAPA to be measurable, meaning that we can track our progress on these indicators over time. We also want to be addressing the most important issues facing our older Ohioans. That's that nature of the problem idea. We should be aligning to other state level plans like the State Health Improvement Plan whenever possible. We want to choose outcomes that we can impact through evidence-informed strategies. That's a really important piece that we'll discuss as we move along. And then finally, that last criteria that you see in bold, for these priority factor areas like community conditions and health behaviors, we need to be thinking about how the outcomes that we prioritize connect to the outcome areas, social connectedness, population health, and preserving independence. So for example, how do our priorities in physical activity and in transportation connect to the priorities that we have related to social isolation and depression? We want to make sure that those connections are there. With those criteria in mind, here were the survey results for the community condition subtopics. The prioritization survey asked you to prioritize your top 3 subtopics. And so we're going to focus on those top 3 for our discussion today: housing affordability, access and quality, transportation, and economic conditions. The goal is to narrow down each of these areas to one desired outcome to address in the SAPA. So one outcome for housing, one for transportation, and one for economic conditions. The survey also asked you to choose your top 2 subtopics for health behaviors, and those were physical activity and nutrition. So again, we'll be narrowing these down to one desired outcome each. That's the process we're going to go through together today. Before we do that, we also want to provide you with an update on how the priorities are shaping up in the other areas of the SAPA. These are still a work in progress. We're still working through this, but we wanted to give you an update on where those stand as of now. So as of today, both the population health and the social connectedness and preserving independence work teams have met. So they've already gone through this prioritization process that we're going through today. And based on that process, what you see on your screen here, these are the outcomes that those groups selected. So for social connectedness, we have social isolation and volunteerism. In population health, we have depression, cognitive difficulty, and high blood pressure. And for preserving independence, chronic pain, and falls. Moving over then to the priority factors. So this today is our first work team meeting in the priority factor area. So none of these subtopics have yet been prioritized. What you see on your screen here, these are just the subtopics that came out of those survey results. So we've already talked about what that looks like for community conditions and for health behaviors. For access to care, the priority subtopics are availability and affordability of long-term home and community-based supports, workforce capacity, and healthcare coverage and affordability. Again, here is how those priorities fit into the overall SAPA framework, which gets us to our goal of all older Ohioans achieving their full health potential. So this is another place where we'll pause and see what questions you have about the process that we're going through today, or the survey results, anything of that nature before we head into the nitty-gritty of our work for today's meeting. So if you'd like to raise your hand and ask a question, that's great, or you could type something into the question box. I'm going to give you another minute or so. I'm not seeing anything right now. Okay, well, if questions come up as we continue to move through this process, you all are always welcome to either raise a hand or drop a question in the question box, and there will be points throughout today's meeting where we'll be able to answer those together. So now I'm going to pass it over to Zach, who's going to walk us through some of our considerations for prioritizing today.
Thanks, Haley. And thanks to all of you. It's wonderful to be talking to you all this afternoon, some of you for the 3rd time. So I know we've said it, but we mean it. Thank you so much for your time and participation in this process. So as you've heard from all of my colleagues today, prioritizing is a difficult and also important step in developing an effective action plan, and that's what we're going to do today. today we're going to prioritize an outcome for these topics related to community conditions, economic conditions, housing affordability, access and quality, and transportation. And we'll also prioritize an outcome for these topics related to health behaviors, nutrition, and physical activity. We're going to use the same prioritization criteria for outcomes as we used for the subtopics. And today we're really going to be focused on the first, fourth, and fifth considerations on this list. In terms of ability to track progress, that first consideration, we're going to let you know today if there are state level indicators to track progress on the outcomes and whether data can be disaggregated by demographic factors such as race and ethnicity. As a reminder, the ability to disaggregate data allows for priority populations to be identified in the plan. With regard to the potential for impact consideration, there really should be evidence-informed approaches to addressing the outcomes that we select. And today we're going to be providing some basic examples when those strategies are available. And then finally, in terms of connection to SAPA priority outcomes, we are going to be giving you some input on that, but please do be considering the connections to the selected priority outcomes as we are moving through this process. And there's a reminder, Haley just went over these, so I won't read them again, but here are those priority health outcomes that have been selected so far. Now, before we dive into the outcomes and indicators, I'm just going to give basic information on some of the sources that we look to for indicators. To identify indicators in general, we look to sources that were used in the summary assessment of older Ohioans, which was recently released by ODA. We also look to other sources that advisory group members and our partners at the Ohio Department of Aging pointed us to. All of that said, there may be other better indicators or better sources for some of the outcomes that we discuss. So please, if you do see an outcome and you're thinking, well, why didn't they select this indicator from that source? It might just be because we weren't aware. Please type that information into the questions box or follow up with an email. So the Ohio Medicaid Assessment Survey is an Ohio-specific survey that collects information on health status and health factors. Data is collected every 2 years, but not for all of the indicators. Data from this source can be easily disaggregated by sex, age, race and ethnicity, income, disability status, county type, and insurance type, which is one real strength of this source. The next source is Behavioral Risk Factor Surveillance System. It's a survey that collects information about health factors, including behaviors and healthcare utilization, and also health outcomes such as chronic disease prevalence. Using publicly available data resources, it is easy to disaggregate this data by age, race and ethnicity, income, and education. So that's an advantage of the BRFIS. And another advantage is that it is weighted, this survey is weighted to represent the entire population. Whoops, it looks like I skipped ahead a slide early. I apologize for that. The next source that we're going to talk about is the U.S. Census Bureau American Community Survey. The Census Bureau administers a number of surveys that collect information about people and housing in the U.S. One major benefit of this survey is that data can be easily disaggregated, and many different organizations compile census data into secondary sources and reports. One of those secondary sources is the AARP Long-Term Services and Supports State Scorecard. This report is produced periodically every 3 years or so, and it provides a really comprehensive analysis of outcomes for long-term services, policies to support older adults, and also issues facing people living with disabilities. There's also a real focus on spending in the system. Now, while this report does provide really in-depth analysis on important topics, some of the indicators really are pretty difficult to understand without a lot of additional context, so that is a consideration. So now, seeing no questions in the questions box, as a reminder, if you do have a question, type it in there at any time and we'll stop periodically to address them. I'm going to move on to discussing outcomes and indicators in community conditions. So the first subtopic under community conditions is economic conditions. And here the outcomes we're proposing focus either broadly on improving financial stability or on reducing poverty. In terms of impact on the priority health outcomes that are selected, both poverty and financial instability more broadly have been associated with worse health outcomes, and particularly worse mental health outcomes. Often exposure to persistent stress due to finances is cited as one of the reasons for worse health outcomes. In terms of measurability, in general, the outcome of reducing poverty is more measurable. But it impacts a smaller number of people, right? Those people who have incomes below the federally designated poverty level. In contrast, the outcome of improving financial stability is much broader. It's also more challenging to find a summary measure. And one way to limit the scope of that broader outcome would be to focus on a particularly at-risk group, such as people who are living alone. So now we'll talk a little bit about the indicators and strategies that are associated with these outcomes. So first we have the broader improved financial stability outcome. Unfortunately, finding a state level indicator of financial stability that's not specific to one type of savings or retirement strategy or tax benefit is very difficult, and we've not been able to find one. We did, however, find a 2015 Census Bureau report that uses 2013 data to estimate the net worth of Ohioans. Most of the other data we found was at the national level, so this one was at the state level. The strategies that we've listed here are examples, but it is worth noting that most strategies to improve financial stability later in life work best when they are implemented earlier in life. So that's just a consideration as we consider this outcome. The next outcome we're proposing is improving financial stability specifically for people who are living alone, excuse me. When we dug into the research, what we learned is that among older adults, people who are living alone, and particularly women who are living alone, are at a higher risk of experiencing financial hardship. And that's even among people with incomes that are below that federally designated poverty level. And this again is why we've proposed this outcome related to financial stability. The indicator we've selected comes from ACS, and it's actually two indicators. It'd be median income for males and then females ages 65 and older who live alone. Unfortunately, this indicator cannot be disaggregated using publicly available tools from the census. Now, while in terms of strategies, most of the strategies, again, are better implemented earlier in life rather than later in life. However, focusing on the population that is living alone might give us some real opportunities. While most of these strategies would apply to people who live alone and people who live with others, there may be specific ways to target interventions to this population. For example, one strategy we mentioned is matched dollar incentives for saving tax refunds. We could tailor this strategy by potentially increasing the match rate for older adults living alone. Okay, the last outcome we'll select is reduce poverty. One major advantage of this outcome is that it is SHIP aligned. And this indicator, the percent of adults ages 65 and older with income below the federal poverty level, is also ship aligned. Data for this indicator from the census is easily disaggregated by race, sex, and disability status for the older adult population. Now, living wage laws are an example of a strategy that is rated effective at reducing poverty. Notably, however, this strategy has really faced political opposition in Ohio. Other strategies that we've listed here increase income, employment, or other outcomes that are related to poverty. And these strategies could also be highlighted if that outcome were selected. All right, so now we are going to move on to discussion about these desired outcomes. And after that discussion, we will throw a poll question, which asks you which of the 3 outcomes you would like to prioritize. Before we get to the poll question, we'd just like to open the floor. People, please raise your hands or type into the questions box and answer the question, of these desired outcomes, which should be prioritized in the SAPA? All right, it looks like we have a hand up from Orion, and I've got you unmuted.
Okay, thank you. Good afternoon. This is
Good
Orion
afternoon.
Bell. I'm the CEO at the Benjamin Rose Institute on Aging, and one of our subsidiaries here is ESOP, which does economic security for older adults targeted at this population. And in the just think about the desired outcomes and the financial stability, have we considered the impact of maximizing participation in the public benefit programs as a part of this outcome for financial stability, meaning things like SNAP, the Medicaid QMB, the assistance with paying the Medicare copay premium and those kind of things. Is that part of the conversation here? Just think about the tools we have to look at and things to measure for the population.
Yeah, so I was just flipping back through the slides here. I just wanted to show on the reduced poverty, 2 of the strategies that we have were supplemental security income program participation and low income home energy assistance program. I think that kind of gets at the broader point about public benefits participation and getting people who are eligible enrolled into those programs. We listed them here under reduced poverty, but I believe that we absolutely could include them in a conversation about improved financial stability as well. And Orion, I apologize for mispronouncing your name.
Oh no, everybody does. Thank you.
Thank you for your input. Other questions or people who would like to raise their hand and make their voice heard? And I will flip back to our indicator or outcomes. Oh.
We really would love to hear from other folks on the call, just to get a sense of, what are your thoughts about these desired outcomes? Are there ones you feel that are stronger than others? The more input that we can get now, I think the better informed you will be going into the polling.
All right, well, I'm not seeing any other hands raised or questions going into the questions box. So I'm going to ask Alana to please go ahead and throw that poll. We'll leave it up for a minute and we'll continue checking for hands and questions. So if you were typing, please continue doing that. If you're ready to vote, please go ahead and vote. As a reminder, if your computer seems to be giving you trouble, try minimizing your screen and then voting on the poll. Alana, if you want to let me know when you want to go ahead and throw those results, it'd be great.
Okay. Give people just another second to vote and then I'll put them up.
All right. So it looks like we did have improved financial stability, received the most votes. Improved financial stability for people living alone, received the fewest votes, and reduced poverty came in a strong second. Thank you very much for your input. Alana, if we can go back to the slide deck, we'll go ahead and move on to our housing outcomes next. So here the subtopic prioritized through the survey was housing affordability, access, and quality. Here are the housing outcomes that we're putting forward. In terms of impact on the priority health outcomes, housing problems, both related to affordability and related to quality, have been associated with worse health outcomes. And one outcome that we're proposing, reducing housing cost burden, is more narrowly focused on the problem of housing affordability, while the other outcome brings in other housing quality problems. In general, and I want to say this before we dive in here, indicators that are available at the state level do not adequately represent the real needs of older Ohioans related to housing. We know and understand that, and we've tried to identify the best available indicators. But again, if you know of better indicators that maybe more accurately reflect the needs of older adults, please let us know. So housing cost burden is defined as paying more than 30% of income on housing costs, including utilities. And here, the indicator that we're proposing comes from the ACS. Unfortunately, this indicator cannot be disaggregated at the state level for the older adult age group. And strategies related to housing cost burden are very straightforward. But one potential weakness of this outcome is that many of the strategies may not be politically feasible in Ohio, such as rent regulation policies. No real price regulation policies have gotten much of a hearing here in the state. And other policies may not be particularly applicable to state policy. And a good example of that is the Section 8 program, which is evidence-based to reduce housing cost burden, but it is federally funded and administered through partnerships with local metropolitan housing authorities. So state impact is a little limited. The next outcome, a major advantage of this outcome is that it is SHIP aligned. And the first indicator that we have here is also in the state health improvement plan. The first indicator, the number of affordable and available renter units per 100 renter households with incomes below 50% of the area median income, it comes from the ACS. It is not specific to older adults, and it does come from an analysis, well, it's published in a secondary source, and it's an analysis from a national organization. Data for this indicator cannot be disaggregated, and it's also not specific to the older adult population. The other indicator we have here is specific to the older adult population, and it brings in housing quality problems. It's the percent of households with adults ages 62 and older who live in housing with at least one housing problem. and that is lacking complete kitchen facilities, lacking complete plumbing facilities, housing being overcrowded, or again, the household being cost burdened. This indicator also comes from analysis of census data that is published annually by HUD, but the data for this particular indicator cannot be disaggregated at the state level. Strategies for increasing housing quality and affordability include housing rehabilitation loan and grant programs, such as the Home Weatherization Assistance Program, and also the federal low-income housing tax credit and local inclusionary zoning and housing policies. So again, the strategies are straightforward for this particular outcome. So now we're going to move into discussion on these outcomes. Again, please raise your hand or type into the questions box. It looks like we do have quite a few questions that have come into that box since then while I was talking, so I'll go ahead and read those now. So one question is there a thought about enough of housing? Is there a thought about enough of housing that meets the needs for older adults? Cost is definitely one component, but are there other things that could impact availability of housing? There are efforts to build more affordable senior housing using various tax credits incentives. And then there was a follow-up to that question from Beth, or that comment from Beth, that says, I don't know of a data source for this. And that was going to be exactly my response, is that we are a bit limited by the indicators and understand fully that the needs of older adults related to housing are more specific than the indicators we have. I think this is something that we can handle through the strategies that are selected related to either of these indicators. And then we also have a question from Jeremy Morris. Was accessibility being factored in the indicators? And the answer quite simply is no. All that's represented by those indicators is exactly what's spelled out. All right, and we have another question here from Emily. Are there indicators for how accessible housing is as mobility changes among older adults? So this is kind of the third question along those lines. And unfortunately, in my review of the housing accessibility data, there's not a lot out there. We did come up with, there's a source called the AARP Livable Communities Report, and they actually look at the number of zero-step households from the ACS. That data was very old. I'm working from the top of my head, but I think it was like 2013. So yeah, we really tried to look and struggled to find better indicators. So I hear these concerns very loud and clear. And again, if you've got ideas, please send them our way. I think I've addressed all of the questions that have gone into the questions box. And I'm not seeing any hands raised. So understanding, of course, that if you have something to say, please raise your hand now or continue typing in the questions box. I'll ask Alana to please go ahead and throw the poll. All right. So our poll question is, which desired outcome do you think is most important to prioritize in the SAPA? Reduce housing cost burden or improve housing quality and affordability?
And as you guys are voting on that, this is Haley, and I'm just going to reiterate something that Zach said earlier. We know this is kind of not satisfying, right? That these indicators don't really measure the things that we would like to measure and don't necessarily get at the things that we feel are most important for housing for older Ohioans. But those strategies can be tailored specifically to those needs. So the squishiness or the not, you know, those indicators not being exactly what we want doesn't mean we can't impact the things we want to impact.
Absolutely.
So I don't want you all to feel too frustrated by that. We could all feel appropriately frustrated about the indicators together.
Right. Yes. That said, our goal is to be measurable, so we know where the ball is and we can move it toward the goal, to use my sports analogies here. So Alana, it looks like we've got good participation in the poll. Do you want to go ahead and throw those responses, please? All right, so right now we're at 85%, pretty clear consensus on improve housing quality and affordability. So thank you very much for your input. And with that, we will move along to the next section on transportation. Sorry. Okay. Sorry about that. Here again, our outcomes are specific or broad. First, we're going to look at the more specific outcome of improving access to transportation to healthcare. The indicator that we selected here is the percent of adults ages 55 and older with transportation barriers to healthcare. This comes from the Ohio Medicaid Assessment Survey. This indicator is not publicly available on the OMAS dashboard that's published by the Government Resources Center, but it could certainly be requested from the Government Resources Center, which administers and manages the OMAS data. This indicator could be disaggregated by race, county type, sex, insurance type, and other factors upon a request, again, to GRC. And one strategy in the registries that we reviewed included a reference to improving transportation to healthcare specifically, and that was rural transportation services. And I want to say here up front, we know and we've heard in previous meetings that transportation is an area that you all work in a lot, and it's consistently raised as an issue, for example, in the State Plan on Aging and summary assessments. So we hear loud and clear the need for this, and also we will be listening loud and clear for your input when we get to looking at strategies around this topic. Here we have the broader outcome of improving transit access. Here, again, the indicators are not particularly strong, but that does not limit us in our ability to put together a strong action plan around an outcome. Here we have an indicator from the ACS that looks at the percent of households with a householder 65 years or older that have no vehicle available. Now we've heard loud and clear in other work groups that not having a vehicle can be a personal choice, and it's certainly not the only indicator of access to transit. The other indicator we've selected is an index of transportation policies to support older adults that includes voluntary driving programs, access to non-medical transportation for Medicaid, and then coordination of transportation through human service councils. So it looks at a real constellation of policies that support transportation for older adults and ranks states on an index. This might be a good indicator to direct some work here in the SAPA, but it is one of those indicators that's more in depth and really requires quite a bit of context to understand. Related to strategies, here are two that came up in our review. We know, again, that you all are doing lots of work in this area, so we really are going to be relying on your expertise as we select strategies during our next work team meetings. So now we'll move on to discussion about the transportation outcomes. You've heard me go through the instructions now a few times. If you'd like to speak, please raise your hand or type into the questions box. Doesn't look like we've got any new questions that have come in there, so I'll just give us a few minutes. All right. I'm not seeing any new questions or hands being raised. You all are a decisive group today, and we really appreciate, again, your input. Alana, if you wouldn't mind, please go ahead and throw that poll question. All right, so which desired outcome do you think is most important to prioritize in the SAPA? Improve access to transportation to healthcare, or improve transportation access in general? Understanding that the search for better indicators will continue. All right. In the early voting, we've got pretty clear consensus on this. Getting a theme that you're all wanting to be broader in approaches rather than more specific. This is a big topic, community conditions, so that really comes as no big surprise. All right, Alana, if you wouldn't mind going ahead and throwing those results. And 93% of you selected improved transportation access over improving access to transportation to healthcare specifically. Thank you so much for all of your input. Again, if you have questions or follow-up on better indicators specifically, please send a follow-up email or type into the questions box. Now I'll turn it back over to Haley to talk about health behaviors.
Great, thanks, Zach. And thanks to you all. This is really hard work, and so we appreciate you thinking through this with us and offering your feedback on these outcomes. So we are now going to move in to health behaviors. And compared to community conditions, there's a lot fewer outcome options in these areas that we're going to discuss. So what this will look a little different than what we just did with Zach. I'm going to show you what's available. We'll discuss maybe some indicators, so some different things related to that. And although we won't have anything to vote on within health behaviors, there are some places where your feedback is going to be really important. So that's what that's going to look like. And let's start with nutrition. So our options for desired outcomes here are improve nutrition or reduce malnutrition. If we select improve nutrition, we have these two indicators available to us. One measures fruit consumption and the other measures vegetable consumption among Ohioans ages 65 and older. Both measures come from the BRFIS, so they can be broken out by lots of things: race, ethnicity, sex, income, education. They are, though, only collected once every other year. This outcome and these indicators specifically are SHIP aligned. So that's a real strength of this outcome. And to be clear, for improved nutrition, if we were to select this outcome, we would likely include both of these indicators as things to measure in the SAPA. We'd be measuring both fruits and vegetables. We won't make you all choose between fruits and vegetables. Alternatively, we could choose reduce malnutrition as our priority outcome. Unfortunately, we don't know of a specific indicator here that measures malnutrition. And we've done quite a bit of digging and are not able to find an indicator related to malnutrition specifically. However, we know that malnutrition is a really important outcome. So we'd like to get a little bit of context from you all today and think about how malnutrition might be able to be addressed through strategies in the SAPA. Before we do that, we're going to show you what strategies Some example strategies that we've pulled for improved nutrition for that outcome. We know that there are many strategies available in this area. I'm sure you're aware of many more that aren't on the screen. We know this is an area that's really ripe with a lot of potential for impact. Our question is, are there specific strategies available to reduce malnutrition? Are these strategies generally the same as the strategies used to improve nutrition? Are they a different set of strategies? And I guess the specific question to think about as you respond is, what policies and programs can be deployed to specifically address malnutrition? So that's the conversation we'd like to have. Again, we're not really going to be able to vote on this because there's so little here to discuss, but we'd love to hear feedback on how this can be shaped and formed so that that malnutrition outcome, that we can get a piece of that into the SAPA. So what strategies are available on malnutrition? And we'd love for you to type into the question box any information you have, or raise your hand and share with us your expertise on addressing malnutrition for older adults.
All right, Haley, it looks like we have a question from Orion, I believe. I'm going to unmute you if you'd like to go ahead and speak.
So I just have a question not about the strategies, but on the indicators.
Yeah.
I know that the Title III nutrition programs, the area agencies on aging and some of the programs there, that there is a nutrition risk assessment and a periodic survey done of participants in the OAA programs about their diet and dietary intake that goes beyond the fruit and vegetable question that's in the BRFIS. Mm-hmm. And that I wrote that's not everyone, because most folks are not able to participate in the OAA Title III programs. But I wonder if there's anything from those as a proxy, because that is comparative data with other states and some other information, that some of that might be helpful. I'm thinking the folks that are on, if there's anybody on from the Scripps Gerontology Center that might have some insight on that, because I know they do a lot of the review of those programs year over year, and that one is annual, and it's done with nutrition programs across the country, not just in Ohio.
That's a great thought. I wonder if either Zach or Ashley have thoughts to share on this.
Sure, I can chime in. This is Zach, and actually we did talk with our partners at ODA about that questionnaire and about potentially using that and a more uniform application of that assessment to build an indicator to track malnutrition. And I think that is certainly an issue and a potential lever or vehicle for collecting that data that we can highlight in the SAPA. Again, and I just kind of a general reminder on the indicators is we've tried to identify indicators that look at the state level, and that is challenging with administrative data. So that's kind of why we hadn't included an indicator from that OAA reporting on this slide, but we certainly had that in conversations and could look into it for sure. I also want to note that in the questions box, somebody noted that there was a report issued by a state commission on malnutrition, and we're very well aware of that report and look to it specifically around the recommendations related to data collection and reporting on malnutrition. So thanks for pointing that out, and we can also look there for strategies too, Beth.
Perfect. I'm gonna also unmute Ashley Davis from ODA.
Hi, everyone. Can you hear me okay?
Yeah, you sound great.
Okay, great. Thanks so much for the comments. Thanks for everybody being on. This is a really great group. So I hope you guys are you know, making sure you're putting in comments for HPIO to consider. Two things I would add. Yes, I think that the home delivered meal and the congregate meal programs in Ohio use what's called the Determine checklist, and it's an 11 questionnaire, and it does include questions around food intake, some difficulty chewing, swallowing, physically able to shop, those types of questions. We have some challenges with getting data across the state consistently around the nutritional score. And so that is something that we're aware of and looking into, because, you know, it does screen around, you know, 45,000 Ohioans. So, you know, there would be a great benchmark, like you said. So something we're definitely attuned to and looking into, and something that was brought forward by the Malnutrition Commission a couple years ago when we were working on that report. The other thing I would share is that we have also successfully advocated for a couple malnutrition questions on the behavioral risk factor surveillance system questionnaire that was just completed its first year of data in 2019, and we are hopeful to see those results soon. I think about midsummer, and that'll be our first you know, state level malnutrition data. Again, it's the first year of data though, and we used a validated nutrition screening tool to put those questions on. So I think this is an area that as years to come we can build and, you know, build with our partners. So thanks for those questions and comments.
Great, thank you, Ashley. Other thoughts on malnutrition, particularly around strategies to address malnutrition? Are those different than these sorts of strategies we see here on the screen related to improving nutrition? And I'm just gonna.
I think I
Amy
hand
Bain.
up Amy. Yeah,
Oh.
Amy, I'm gonna unmute you if you'd like to go ahead and.
Okay, thank you. I was wondering if an additional strategy here could also be engaging physicians during the Medicare annual wellness visit, because there is a portion on there that covers, in addition to like fall prevention, tobacco cessation, they also cover nutrition, physical activity, and weight loss during that. So during that visit, there could be an opportunity to provide additional education and counseling services around nutrition.
Okay, thank you. That's great.
Yeah, it seems like that annual wellness visit may be a strategy to address several of the priorities that have risen.
Mm-hmm.
Thank you for bringing that up.
Absolutely. We also have a comment in the box mentioning SNAP enrollment and use as a strategy, which absolutely alongside, you know, we have WIC and seniors farmers markets on the slide. I think engagement in those programs is absolutely something we would want to include. So thank you for that. So in general, I guess I'll just ask one more question, then we'll move on to physical activity. Is the thought that addressing nutrition to improve nutrition among all Ohioans, all older Ohioans, is that a very different thing with very different strategies compared to improving or reducing malnutrition for those older Ohioans that are malnourished, right? So that's sort of the idea. There are many, many older Ohioans whose nutrition could be improved. there's a subset of older Ohioans who are currently malnourished. Is the thinking about that, are those two very different sort of approaches with very different sets of strategies, or are we really talking about a set of strategies that increases nutrition for all groups? That's sort of the nugget we'd like to leave with, and you're very welcome to either raise your hand and respond to that, or just throw some quick thoughts into the question box. But we'd love to hear from several of you on that, if possible. Your input really matters. Seeing no hands, what I'm going to do is just leave that question out there for you. Please, as we keep going, continue to think about it and throw anything, any thoughts you have into the question box. It will be really helpful, particularly for framing our next meeting together when we're talking about those strategies. We'd love to get your feedback on that as early as possible so that we can all have a really clear discussion the next time that we're together. So thank you all for that. I'm going to move on now to physical activity. If I can advance my... Perfect. Okay. So the final subtopic we have to discuss together today is physical activity. And here we only have one desired outcome available to us, which is to improve physical activity. In addressing this one, there are two potential indicator options. So we could either choose the first, physical activity guidelines, which measures the percent of older Ohioans who meet physical activity guidelines for strength and aerobic exercise. This measure comes from the BRFIS. It can be disaggregated in lots of different ways. It is only collected every other year. The other indicator here measures the percent of older Ohioans who participated in any physical activity outside of their regular job. So this is another BRFIS measure. It can also be disaggregated by race, ethnicity, sex, income, education, which is awesome. It's also collected every year. And this indicator, the any physical activity indicator, and the physical activity, improved physical activity outcome, both align with the State Health Improvement Plan, which is a great strength too. We know there, like the nutrition area, and I'm not advancing my slide, there are many, many strategies available to us to improve physical activity for older adults. We threw a couple of examples up here, but there are lots of others that we know that you're aware of. This, like nutrition, is an area where we are ripe for improvement, which is great. So our question here, again, we don't have anything to vote on because we just have our one outcome. But which indicator do we think is a better fit for the SAPA? And Alana is trying to help me be able to advance my slides, and it's just not wanting to let me. But we are almost done. So this is our last opportunity to share feedback. Let us know what you think. Which of these indicators is the best measure for improved physical activity? We want to think about older Ohioans meeting those physical activity guidelines. These are the physical activity guidelines as applied to the entire adult population. They're not specific older adults physical activity guidelines. So that's something to note. Do we want to think about older Ohioans meeting physical activity guidelines, or do we want to be measuring the percent of older Ohioans who are participating in physical activity in general? So welcome to raise your hand on this. Let us know which of these is preferable, or comment in the comment box and let us know what you think. This is your last opportunity for feedback on the call today. So we would love to hear from you if you have thoughts.
I think in addition to what Haley has asked, if you are aware of any resources we should look to for evidence-based or evidence-informed strategies that can really improve physical activity among older Ohioans, please drop your resources into the question box and we will make note of them. So if there are particular resources or even strategies that we really need to make sure that we include, please let us know by commenting on those in the question box.
Absolutely. Thank you, guys.
Haley, we had one question from Orion about the measures on physical activity. Are these measures based on self-reporting? Yes, they are based on self-reporting to the BRFIS. And these are all calculated variables, meaning in the survey, they asked questions about people's physical activity and then used those answers to calculate these two indicators for Ohio and other states. And so they are comparable across states, but to answer the question directly, yes, they are self-report.
Great. Thank you both. Any other thoughts on physical activity? Indicators, strategies, things you want to make sure that we know before our next time that we meet together. All right, friends. Well, that is it for our discussion today. I'm going to hand it off to Reem, who's going to wrap us up for our meeting this afternoon. Please, we're going to be together for another few minutes. If thoughts occur to you, the question box is open, so that's still available. With that, I'm going to pass it over to Reem.
Thanks, Haley, and thank you, Zach and Carmen, for your input, feedback, discussion earlier. We will move on to next steps. Just a quick reminder of the timeline for this work. It will be a busy summer, and we are thankful to all of you for the engagement and feedback that you've had throughout this process and that we hope you continue to have through the summer. We have several work team meetings coming up over the next few weeks. So of course, today was the Community Conditions Health Behaviors meeting. This Thursday, we have the Access to Care work team meeting where we will be going through a similar process to prioritize the outcomes under Access to Care. If you have not signed up for that work team and would like to attend that meeting, please do let us know. You can either email any of us or just let us know by dropping a comment into the question box. We will, as Haley has mentioned, have target setting and strategy meetings in July, focused on the priority outcomes and the priority factors that we've decided upon through these work team meetings. As we think about those work team meetings, please let us know if there are additional stakeholders that we should reach out to that can provide us with guidance and expertise in some of the areas that we have discussed today, or those that might be applicable to other outcome areas that we have identified for the previous work team meeting. So please feel free to type those into the question box or email us with suggestions of folks that you think would be important for us to include in those work team meetings. Reminder that the webinar will be recorded and posted on the SAPA Advisory Committee page. If you just want to even hear the recordings for the other work team meetings, they are available and posted on that page. We know that identifying a strategic set of priorities to focus on in the SAPA is difficult work, and you have gotten us a step closer to getting there. We want to make sure we again acknowledge and thank all of the input that you have provided, and emphasize that this is about developing a coordinated approach that highlights a concise set of priorities that both state and local partners can work together on to improve the health and well-being of older Ohioans. And as I mentioned earlier, this includes both state action to move forward on some of these strategies that we are going to identify, as well as partnerships within the Aging Network and partnerships that can be created outside of the Aging Network with other sectors that can really impact and move the needle on the outcomes that we have identified in the SAPA. I want to pause here just to make sure that we don't have any additional questions or comments. So if you have anything about any comments or feedback about anything that was covered earlier in the webinar, you are welcome to share those thoughts here at this time, or if there's additional questions that you have or other feedback that you would like to provide, this is the opportunity to do so. And I've noted that some folks have already asked to be put on other work team meetings, so the Access to Care work team meeting that is coming up on Thursday, and we will certainly make note of that. I don't see any hands raised. Do you want to keep the question box open for just a few seconds? And I will end our webinar, but I will keep the question box open for just a few seconds for any final thoughts or comments. Again, thank you for your participation in this work team meeting, and we look forward to our continued work with all of you over the next few months. Have a great rest of your afternoon.